Newly confirmed cases of COVID-19 are surging among unvaccinated Americans nationwide. More than 184,000 people tested.
Hello, today I present to you an extremely attractive application for music lovers. It's completely free. You can listen to music online or download unlimited music to use whenever you don't have internet. The powerful search function helps you find anything you want. Trust me. It's hard not to find what you're looking for because the search function is really powerful. Application download link is attached in the description of the video. I'm pretty sure you'll like it. Thanks.
Positive for COVID-19 across the country on Monday alone. This comes as several states prepare for students to return to the classroom. Nearly 94,000 cases of COVID-19 were reported in children just last week. In Texas, Governor Abbott is standing by his recent executive order banning mask mandates in schools across the state. Meanwhile, cities like Austin, Texas, are running out of ICU beds as Texas hospitals are inundated with new COVID-19 patients. Authorities there activated a citywide emergency alert system over the weekend, warning residents of the, quote, dire situation within the city. CBS News' Debra Alfarone has more on the latest spike of new cases nationwide and how the return to school could impact these numbers.
Many students are starting the new school year today in Florida at a time when COVID cases are surging among kids. Nationwide, the American Academy of Pediatrics says nearly 94,000 cases were reported in children between July 29th and August 5th. But Florida Governor Ron DeSantis recently signed an executive order banning mask mandates in Florida's schools.
It's about parental choice, not government mandate. And I think ultimately parents will be able to exercise the choices that they deem appropriate for their kids.
In Texas, Dallas public school students will be required to wear masks when they return next week. The school superintendent issued a temporary mask mandate Monday in defiance of Governor Greg Abbott.
Governor needs to run the state, and I need to run the district. And as the chief executive officer, I'm doing what I believe is in the best interest of the school district at this time.
The Biden administration continues to stress that vaccinations are the best way to control the virus, and that may soon include the U.S. military.
In a memo obtained by CBS News, Secretary of Defense Lloyd Austin announced that he would like to institute a vaccine mandate no later than mid-September or as soon as the FDA fully approves a vaccine, whichever comes first. But there's already been some pushback from Louisiana Congressman Clay Higgins. In an open letter to the defense secretary, Higgins wrote, "Biological threats come and go, whereas America is forever." And this is still America, good sir. Freedom matters. A Pentagon spokesman said it's premature to talk about consequences for service members who refuse to get vaccinated. Debra Alfarone, CBS News, the White House.
Joining us now for more on this is Dr. Ogechika Alozie. He is the medical director at Sunset ID Care in El Paso, Texas. Dr. Alozie, welcome. Thank you for being with us. So we are seeing newly confirmed cases of COVID-19 skyrocket across your state. Can you tell us what you're seeing specifically in El Paso?
Yeah, so thankfully and luckily, El Paso has been spared due to some of the amazing work the county and city has done around vaccinations. But in Austin, Houston, Dallas, major metropolitan areas of 7 to 10 million, they're running out of ICU beds. As you said, Austin has 2 ICU beds left. And so this is really disappointing that we're experiencing what is this surge again after what we went through last year.
And you are on Governor Greg Abbott's Infectious Disease Preparedness Committee, along with the Texas Medical Association's COVID-19 Task Force. The governor is adamant that he will not impose any statewide mask mandates despite the latest surge of cases, but he's also prohibiting local officials from imposing their own mandates. What are you, as a member of the committee, advising him to do if a mask mandate is not in the equation?
Yeah, we've had robust conversations about this, but I think it really is where people and parents have to understand that politics and politicians are getting in the way in this case. They have to take that personal responsibility. I have an 11-year-old and a 14-year-old. One can get vaccinated, one cannot. They wear a mask every day to school, and I expect them to continue to wear a mask. If you're a parent, send your kids to school with a mask. That's the best way to protect them if they can't be vaccinated. if they can be vaccinated and you're on the fence, this is the most dangerous time to be unvaccinated in America. And I think you have to really take a strong look at why you aren't vaccinated. I think the people that are coming into hospitals across our state, and as you know, across the country, are predominantly unvaccinated. And so we need to find a better way to get people to understand the dire circumstances this Delta variant actually faces them if they're unvaccinated.
Now, you make a point that the parents can step in here and say, regardless of what politicians say or regardless of what the superintendent says, I'm going to send you to school with a mask. But, if there are other unvaccinated people in the schools who are carrying COVID-19 and are not wearing masks, those people are also putting your children at risk, even if they are wearing a mask. So, it's still a complicated equation. The Dallas Independent School District is now defying Governor Greg Abbott's executive order prohibiting schools from requiring mask mandates on school grounds. All students, teachers, and faculty there will be required to wear a mask on school properties across the district. So, as we see more children contracting COVID-19, because the numbers of children getting it and getting sick, while still not large, are increasing, do you think that, Dallas is making the right decision here?
I think each school district and each school board has to take their local sort of dynamics into their own hands, right? I think that one of the things that I've said to multiple school boards across the state is, if you really want to protect my children, get everybody in your school vaccinated. And then that layer of protection. I think the other thing that we have to remind people about is a mask is not a mask, right? At this point in time, we don't have a shortage of masks. And so if you're sending your kids to school, it should be a KN95 or an N95. I don't believe a cloth mask cuts it at this point in time, especially with the Delta variant. And I think that each school district has to take that responsibility onto their own selves.
So you would say that, you just deal with your own district and see which way the wind is blowing there and figure out which way to go. It's as a parent, you're obviously a doctor and a parent, so you're coming at this from two different directions. And as you pointed out, the city of Austin is almost completely out of ICU beds. I believe you said they have one left, and the state's healthcare system is inundated by new cases. Of course, the bulk of these patients are unvaccinated, but do you have a sense of what percentage of these hospitalized infections are breakthrough infections?
Yeah, so that's a little bit harder. Not all of the county and city health departments are tracking it. What we are seeing is that there's a range of about 90% to 98% of the persons that are in the hospitals are unvaccinated. Some sort of back of the envelope and anecdotes and talking to colleagues across the state put the percentage of breakthrough infections in the hospital at maybe 1% to 3%. So again, you're seeing a huge break or a huge dissonance between vaccinated and unvaccinated. And that's really why my pitch is to anybody listening right now. If you're not vaccinated, this is the right time to get vaccinated. The Delta variant is more transmissible, more contagious, and we're putting a stress test on this by sending kids to school. Get the right masks and get vaccinated.
And so what are the state's next steps here? Are you at all concerned that the healthcare system could ultimately collapse if the virus continues to surge in your state the way it has been going?
Yeah, it's very concerning, actually, because one of the things that happened last year is that this is regional. And so Texas surged, Florida surged, the Northeast, the Northwest, and we're always able to sort of pull staffing from other parts of the country. As you know, Governor Abbott has asked other healthcare workers to come into Texas to assist us. The problem is that from Texas to Florida, if you look at the heat map that the CDC presents in the New York Times, it's really difficult. Everybody's experiencing a massive surge. And so expansion of hospitals, you're going to see tents. And unfortunately, this is not a good time to be sick in the hospital if you're unvaccinated. And so it'll probably take at least 2 to 3 weeks for this surge to come down. And in that 2 to 3 weeks, even if we start to surge vaccinations right now, we may not be able to protect enough people. Getting those vaccinations protects people, and we can hopefully avoid a future surge.
But are you worried also about this huge population of unvaccinated people, namely children, right? 12 and under simply cannot be vaccinated at this point, or rather 11 and under. Are you worried about those children going into school systems where it's unclear whether all the staff and teachers are vaccinated, whether mask wearing is inconsistent? Are you worrying that schools could become super spreader events?
Absolutely. I have an 11-year-old who just started 6th grade in middle school. And so he knows the drill. He has a mask. He has a KN95. If it gets soiled, he has multiple other masks in his backpack, and he has some surgical masks in case the day goes out of control. I think any parent is going to be worried. We're putting an immense stress test with a variant that's at least 2 to 4 times more transmissible. And so this is where the CDC and the FDA are going to have to make some decisions about what do we do with pediatric vaccines. We've seen in other countries that kids didn't seem to be as affected. However, they also had populations that had a lot more vaccination penetrance across the board. And so this is a scary time to be a parent. It's a scary time to be a child. And so but at the same time, yeah, sorry, go for it.
And what's the latest you're hearing on the pediatric vaccines? Because these tests do seem to be going a little more slowly than we had anticipated. I mean, originally, I think early in the year, there was some speculation that maybe by September there would be vaccines that were available for younger children. So what's the latest you're hearing on that?
Yeah, so as you know, the American Academy of Pediatrics wrote an open letter to the FDA asking them to approve the vaccines under an emergency use authorizations and continue that tracking. There's been some controversy with that because there are people that say the safety signals have to be gotten right for kids that are under 12 because of the concerns about myocarditis in the past. I think we're in a tough situation. I think that we are in a place where the FDA is trying to do the right thing and they're getting buffeted by both sides. If you're a parent, you really have to focus on getting the right mask and hoping that your school district can improve ventilation and potentially improve spacing in your schools.
Great advice. Dr. Ogechika Alozie, thank you so much for joining us. We appreciate you sharing your insight with us.
Thank you.